Surendra Pratap Saxena ji, you want to ask something?
Happy Dhanteras Day and Dhanvantari Day. Sir, I want to know that what is the contribution of Lord Dhanvantari to the present Ayurveda. So, give some brief about his contribution.
Yeah. So we can say Lord Dhanvantari is god of Ayurveda.
Okay.
So he is not a Rishi like Charaka or or Sushruta or Vagbhata. All they are doctors, whereas Lord Dhanvantari is a form of god of not actually Ayurveda, but god of health. But
Okay.
the people who follow Dhanvantari, they are called as Dhanvantareyas, and they are the people who have successfully performed various surgeries. The followers of Dhanvantari are the surgeons, first surgeons of the world. And among them, the first one was Shushrutacharya. Shushrutacharya is regarded as the father of surgery and also father of plastic surgery. So he is the follower of Lord Dhanvantari. There is another group of another lineage of Ayurveda doctors who are general practitioners who used to practice Panchakarma, who used to give Shamana Chikitsa. They were not surgeons, they were physicians. But the followers of Dhanvantari are surgeons, and they have successfully performed so many surgeries long back, so many years before the invention of microscope also. So the first craniotomy, first plastic surgery, all those things were done. And so nicely those details were written in Sushruta Samhita, how they were performing all those surgeries without anesthesia, how they were teaching these surgeries to students, how they were teaching dead body dissection to students. All those things were written in detail. And the greatness of Sushruta, follower of Dhanvantari, is that he was using so many surgical instruments, some almost 3000 years back, and in all sizes and shapes. More than 250 types of surgical instruments were being used by Lord Sushruta. And even today, if you look at the instruments being used by surgeons, you will see that almost all the shapes and sizes and the utility, all those things were already used by Sushruta. I will show you those slides also. I hope I answered your question.
Sir, but at present time in the Ayurveda hospitals, uh, they
Uh-huh.
refer the surgical case to the government hospitals. They do not take over the surgical case in the Ayurvedic hospital. So why this
Exactly.
knowledge is not?
Exactly.
Uh, so
There was a gap in between, because surgery is not something you can learn from reading books. In Shushruta Samhita, so nicely he has described all the surgical procedures they were performing in those times. And the parampara was continuing for many years. But at what particular one point of time, there was rise in Buddhism in India. And during that time, kings who misinterpreted this Buddhism were forcing the Ayurvedic doctors not to perform surgeries, because they used to think that these surgeries were cruel. They are a part of Himsa, and Buddha was promoting Ahimsa. So at that time, because there was no anesthesia, they used to give some decoctions to generate some kind of drowsiness. They also used to give some alcohol so that they will become numb. But still, they were holding the hands and legs while performing the surgery, and the patient was screaming. So all these things was like, they used to be the kings used to think that this is something against Buddhism. So when very popular in India. Many kings have discouraged the surgeons, and after that, due to the continuous invasions by so many Westerners and Muslims and English people, this art of doing surgeries was somehow lost. Luckily, it was not the case with Ayurvedic medicines and herbs and all those things, because they were all written and we were still continuing those things. Whereas surgery, which needs a proper practical um, demonstration by a guru so that the Shishya will learn, that got broke somewhere. And that is the reason why now we don't find full-fledged surgeons. But I'm happy to inform you that there are number of colleges in India which are offering MS Shalya, MS Shalakya, different masters in surgery in Ayurveda, and there are surgeons who are performing surgeries, and there are certain surgeries which are being performed only by Ayurveda doctors, and whenever there is such condition, allopathic doctors are referring those patients to Ayurvedic hospitals.
Okay.
So
So,
yes,
in the case of surgery, the modern medicine doctors suggest antibiotics to for healing. And what type of
yes.
medicine in the Ayurveda for a quick healing in comparison to allopathy?
There are wonderful medicines which heal the wounds faster, much faster than modern antibiotics. There are really good medicines in Ayurveda
So, those
which will
antibiotics,
control the infection and
those
which will control the
antibiotics,
infection and promote the healing. Yes,
but
ask me.
the Ayurvedic hospitals are not referring the antibiotics to the patients, especially in case of some infections. They are not referring such type of medicines. So, why it is so?
No, no. See, mine is an Ayurveda hospital. We don't prescribe any antibiotics. We use only Ayurvedic medicines to control infections. There are
Uh,
so many doctors who are using only Ayurveda medicines, no antibiotics at all.
one tablet was Ceftinil. I think it was Ayurvedic medicine.
Septinil is Ayurveda medicine, yes.
Yeah.
It is for
So,
infections.
it has a good control over the infection.
Yeah, it is good, and there are much better medicines than that. Septinil is popular because it is manufactured by Himalaya company, which is very popular. But there are so many other medicines being manufactured by wonderful pharmacies, which are much better than allopathic antibiotics.
And also the pain relief medicines are not so good in the Ayurvedic system as in comparison with allopathy. So, what do you like to
See,
say?
in some cases, allopathic medicines will help in instant pain relief.
Yeah.
But as far as treating the problems which cause pain, there is no other way other than Ayurveda. For example, if you have severe pain due to disc degeneration in your back, there is some disc degeneration or disc degeneration in your neck, or there is some degeneration in your knee joint, and because of that you are having pain. Maybe if you take allopathic medicine, one you can get relief for that, no, 2 3 hours, 4 hours, but that will never solve your problem, never reverse your degeneration.
Of
So
course,
we
it
treat
can be kidney also.
majority of these majority of the patients whom we treat at our hospital are people with severe pain. We treat the pain management is our bread and butter. That is the only thing with which we run our hospitals. People get admitted with severe back pain, neck pain, knee joint pain, rheumatoid arthritis, gouty arthritis, psoriatic arthritis. These are the cases which are very successful with Ayurvedic treatments.
So, your hospital is a government hospital?
No, mine is a private hospital.
Okay.
Okay,
Okay.
so let's go into the session.
Yeah.
So once again, I want to wish all of you happy Dhanvantari Jayanti. So today, Government of India has declared this day as World Ayurveda Day. One of the greatest contributions to the world from India, apart from yoga, is Ayurveda. So Ayurveda is not just any simple herbal medicine or some system which treats just diseases. So this is a special system, and you can say that Ayurveda is like a user manual for this human body. Whenever we purchase an instrument, a gadget, it comes with an user manual. This user manual will tell you how to use that particular gadget so that it will work without any hiccups, without getting spoiled, and it will last longer if you adhere to the rules and regulations which come with the gadget. But if you don't use that gadget according to the user manual, you might damage it. Similarly, you can say Ayurveda is a user manual for this human body. It will tell you how to use this body so that it will stay healthy forever without the need for a doctor. So that in that way, it is beyond all other systems of medicine which focus only on treating the diseases. Ayurveda is not a system of medicine which tries to treat only diseases. Majority of any Ayurveda literature, whether you take Sushruta Samhita or Charaka Samhita or Vagbhata Samhita or any Ayurveda book, you can find majority of the book, major portion of the book speaks about preserving the health of a healthy person and not about treating the patient. Treating the patient is a secondary objective, but the primary objective of Ayurveda is swastasya swastarakshanam, preserving the health of a healthy person. Because of Corona, people are now really into preserving their own health. Because 2 years we were locked down in our own homes, and now the world don't want to experience that kind of bad period once again. But what happens tomorrow? Some other strong virus or bacteria again invades this humanity. Can we afford to stay for 2 more or 3 more years at home? Is it possible? I don't think so. That is the reason why nowadays everyone wants to stay healthy and they want to give some time to stay healthy. During the Corona time, government asked us to practice sanitation, wash your hands, wear masks, practice social distancing, all those things. And of course, government asked us to take vaccines, and all of us did whatever government told us. But still, even today in our practice, many people come to us with so many side effects they experience after they got treated for Corona, and much more side effects they are experiencing right now after they took vaccines. So then who will help us? What is the solution for this problem? If you look closely, during the Corona time, majority of the people who died or who were on ventilators, who were badly affected by this infection, were those people who are already suffering with lifestyle disorders. Lifestyle disorders are those diseases which we gift ourselves because of our bad lifestyle. If you are not sleeping in time, not getting up in time, not doing physical activity, not eating good food, not exposing your body to sunlight, and exposing yourself to pollution, or experiencing anger, fear, stress, tension, depression, irritation, all those negative feelings, all these things finally culminate into lifestyle disorders. According to World Health Organization, the data is from 2020 or 2019. Every year, 40 million people were dying because of these lifestyle disorders. These are non-communicable diseases. No virus is causing these lifestyle disorders. 70% of all deaths globally were due to these lifestyle disorders. And those people who are suffering with these lifestyle disorders were the people who got badly affected by this coronavirus. What are these lifestyle disorders? As I've told you, diseases which affect our body if our lifestyle is bad, like diseases of your heart, diseases of your lungs, diseases of your kidney, diseases of your liver, obesity, hypertension, diabetes, cancer, autoimmune disorders, where the immune system attacks our own body. All these diseases are lifestyle disorders. And those people who have lifestyle disorders are more prone to infections because their immunity is less. So, why are these lifestyle disorders happening? According to World Health Organization, rapid unplanned urbanization. Suddenly, the whole world is becoming urban. Previously, only people in the cities were having bad lifestyle and the villages were having good lifestyle. But even the villages right now are having very bad lifestyle. And this unhealthy lifestyle is becoming global. Everywhere you find unhealthy lifestyle. Unhealthy diet is also becoming global. And not doing physical activity. Lack of physical activity is also becoming universal. No one wants to do physical activity. Everyone wants automation. And of course, mental stress, anxiety, tension, all these things culminate into lifestyle disorders. The lifestyle disorders are the major challenges for the sustainable development of any country. So, what are the solutions by World Health Organization? World Health Organization says to treat these lifestyle disorders, we have to conduct tests. We have to screen all the people every 6 months and treat them in the initial stages only. Their mantra is strengthening early detection and timely treatment. Detect the problem early and treat it early. So you have to screen all the people in your country every 6 months with for all the diseases, and wherever there is a disease, then treat it. That is the solution by World Health Organization, and they have a target of reducing mortality due to lifestyle disorders by 25% by the time they reach 2025, and by 2030 they want to reduce the premature deaths due to lifestyle disorders by 1/3. But do you think this is the right solution? Should we wait for the disease to appear and then treat it in an early stage? Is it the right solution? I don't think so. The right solution will be to prevent the disease in the first case. So if you look at the Western countries, the so-called rich countries, where this early screening and early detection is possible, they are having wonderful infrastructure, sophisticated machines, all CTs and MRIs and all screening machines, and they can treat the disease early. So in those cases, are they able to reduce these lifestyle disorders? So according to World Health Organization, so in if that is the right way, solution of World Health Organization is right way, you should be able to see better health in developed countries. But according to World Health Organization's data, non-communicable lifestyle disorders are killing people. 70% of the deaths are due to non-communicable diseases or lifestyle disorders in developing countries, whereas in high-income countries, 88% of deaths are due to lifestyle disorders, despite the availability of the best medical facilities and medical care. So what is the solution then? I don't think this early detection and early treatment will help. Solution is very, very simple, and that is following a healthy lifestyle. Problem is complex, but the solution is simple. But we need to have right knowledge for assimilating this actual way of designing your lifestyle. And you need to assimilate knowledge from all the systems which are working towards preserving the health of a healthy person. And once you get that knowledge, you have to implement it in your own life. You have to design your own healthy lifestyle so that you can stay healthy without the need of a doctor. And this is the place where Ayurveda helps. As I've told you already, majority of Ayurveda knowledge is more about preserving the health of a healthy person. So Ayurveda speaks about hita hitam sukham dukkham ayus tasya hita hitam manam cha tacha yatroktam ayurveda sauchate. Ayurveda is a science which speaks about what is good for human body and what is bad for human being. What gives us happiness and what gives us sorrows and problems. What will increase the lifespan and what is best for increasing our lifespan and what is bad for our lifespan. It can calculate everything to the minutest detail, and that is the science of Ayurveda. So Ayurveda says dharmartha kama mokshanam arogyam moolamuttamam. To attain anything, dharma, artha, kama, moksha, for everything you need healthy life, healthy body and healthy mind. And Ayurveda Upadeseshu Videya Paramadaraha, those people who are dedicated towards the health principles discussed in Ayurveda and follow them in their own lifestyle, they will be able to stay healthy and they will be able to get this dharma, artha, kama and moksha. So whatever you want to achieve in life, you need a healthy body and mind. And that is the reason why Ayurveda gives a lot of emphasis on staying healthy. So what is Ayurveda? Ayu and Veda, two words. Ayu is life, Veda is science. The science which speaks about proper life, the way in which you have to lead your life, the right way of leading a life, that is the science called Ayurveda. So Ayurveda is a life science, science which tells about your own life. And I'm happy to share this information that long before the discovery of even a microscope, long before that, in India, Ayurveda doctors were practicing Ayurveda in 8 different specialities, including surgery. Kaya, Bala, Graha, Urdhvanga, Salya, Damstra, Jara, Vrushan, general medicine, ophthalmology, ENT, surgery, psychiatry, pediatrics, toxicology, geriatrics, aphrodisiacs, so many branches, long back, thousands of years back, specialized books and specialized doctors for every branch of these sciences. So it's not just about preserving the health of a healthy person, but also treating patients with various specialities long back, long before the invention of microscope. So the wonderful book called Charaka Samhita speaks volumes about this general medicine. After it explains us how to stay healthy. So Charaka Samhita is a great book. Surendra Pratap Saxena ji, you have some question? Do you have a mic? Yes.
Yeah. Psychiatry is written Bhoot Vidya. Why it is called Bhoot Vidya?
I'll tell you. So that was a term they were using at that particular point of time. And that was not the exact term. There were multiple paryayas. Okay. So Kaya Bala Graha Salya Dam Kaya Bala Graha Urdhvanga Salya Damstra Jara Vrishan. So it is called Graha Vaidya, not Bhuta Vidya. It is Graha Vaidya. Like they were of the opinion that due to the effect of various planets on our human psychology, human brain acts differently, and we have to consider the effect of this environment, effect of the stars, effect of the planets, effect of various changes in the outward environment on the mind of the body, mind of a human being. And that is the reason why it is called Graha Chikitsa. And some people used to call Bhuta Vidya. So in the actual classification, it is called Graha Chikitsa. Kaya, Bala Graha, Urdwanga, Salya, Damsu, Jara, Vrisham. These are the, nomenclatures. So Charaka Samhita speaks volumes about general medicine. And then there is Sushrut Samhita. If you look at this slide, which depicts a picture of Sushrutacharya, even the painter who painted the Sushrutacharya's picture was mistaken, extremely mistaken, because maybe he has not read the book called Sushruta Samhita. If you read the Sushruta Samhita, Sushrutacharya clearly says that a surgeon should not have a long beard or mustache. In fact, he has to shave the entire hair, and keep a very short hair on the head, or even shave the head also, so that we can avoid any kind of infections. So that is very important for a surgeon to have, um, uh, to be hygienic, and regularly cutting the nails, and a lot of hygiene was advocated by Sushrutacharya in this book called Sushrut Samhita. So actually, we all know, people who read the Sushrut Samhita, they know that Sushruta was not having a long beard or long, because they were Maharshis, they were called Sushruta Acharya or Maharshi. They have depicted them wearing a beard, but actually Sushruta was a very, very strict about hygiene. So these were the instruments. These were the instruments Sushrutacharya used. These were only some of the instruments. There were more than 200 shastras and yantras he was using to perform these surgeries. So many different kinds of shastras and yantras, not just for removing a particular tumor, to stitch the skin, to cut the bone, to go deeper, to catch a small vessel. So many beautiful yantras and shastras, and he was, using the names of the animals. You can see Vyagra Mukha Yantra, Vruka Mukha Yantra, like that. Some yantras were named after their shape, which resembles some animal. So many yantras and shastras were used by Sushrutacharya, and these yantras and shastras were used to perform really miraculous surgeries. We can't even imagine how he was able to operate on the brain or on the eye, or how he was able to disinfect. You were asking about the antibiotics. He was doing plastic surgery, removing skin from one place and putting it somewhere else. How he was managing all those infections in those times. And then we have this beautiful book called Ashtanga Hridaya. I strongly recommend every one of you to purchase the Ashtanga Hridaya and read at least the Sutrasthana of Ashtanga Hridaya. It speaks about preserving the health of a healthy person, and I firmly believe that this knowledge is not just for Ayurveda doctors. Every one of us, everyone who is a human being who wants to take care of his own body and mind, they have to read this wonderful book called Ashtanga Hridaya. It speaks volumes about how to stay healthy in a very, very detailed way. Then we have this Madhava Nidana. Madhava Nidana is a book which speaks about the etiology of majority of the diseases and their pathology. What is the reason for a particular disease, and how it is spreading in the body, how it is damaging the organs, how it is affecting the tissues. All those things are written in detail about so many diseases in Madhava Nidana. That is a specialized book. Then we have this book called Sharangadhara Samhita. It speaks about preparation of various forms of medicines. not just some churnas or decoctions or powders or lahyas or so many kinds of medicines preparation. Hundreds of medicines were explained in detail how to prepare them and their effect, how they will work on various diseases. Everything was written in Charangandar Samhita. Then we have Bhava Prakasha Samhita, which speaks about the qualities of herbs and their effect on human body in a healthy condition and in a diseased, in a condition where there is a specific disease, how these herbs will work and how they are working. What are those qualities which are helping the herb in treating a particular disease in detail? So many herbs were discussed by Bhava Prakasha. Then we have this Kashyapa Samhita. Kashyapa Samhita is a specialized book which speaks volumes about diseases of the children, from infants to young children. Different diseases were described. And if an adult gets a problem, he will speak and tell the doctor that he's having so and so problem, he's having so and so discomfort. But whereas a kid who doesn't even know how to speak, he will just cry for any problem. So how to diagnose the reason for crying? Is he having a pain, or is he having a discomfort? Is he having a cramp, or just is he feeling hungry? How to distinguish and differentiate between different kinds of problems? For every problem, the child will cry. So beautifully, all those things were described in this wonderful book called Kashyapa Samhita. So before we go deeper, I would like to bring you back to the basics of Ayurveda. Ayurveda is based on this Pancha Mahabhuta theory. So this 5-element theory: Prithvi, Ap, Tejo, Vayu, Akasa, earth, water, fire, air, and space or ether. These 5 Mahabhutas, which are there outside in the universe, they are also there inside our body. Yadha pindhe tada brahmande. Whatever is there outside, that is also there inside. As is the macrocosm, so is the microcosm. So these Panchamahabhutas, they perform various functions in the form of 3 doshas, or Vata, Pitta, and Kapha. So if the domination of air and space is visible in a body, then the body is Vata predominant. If there is a domination of water and earth is visible, the body is Kapha predominant. Water and fire dominance will result in Pitta predominance. But if there is a balance, then there will be a Samaprakriti. So apart from the 3 doshas, there are Sapta Dhatus: Rasa, Rakta, Mamsa, Medo, Asti, Majja, Shukra. Rasa is the tissue fluid, Rakta is blood, Mamsa is muscle, Meda is fat and connective tissue, Asti is bone tissue, Majja is bone marrow, Shukra represents the reproductive system. These 7 tissues are the basis for human body, and they are the reflections of various influences of this Vata, Pitta, Kapha on human body. You will not be able to look at Vata or Pitta or Kapha by opening the body, but you will be able to see all these 7 dhatus inside the body, which will tell you volumes about the dominance of a specific dosha or a disturbance in specific dosha. They will be showing the physical manifestations of the disturbances in Vata, Pitta, Kapha whenever there is a disease. And there are 3 malas. Dosha, dhatu, mala, moolam hi siriram. Doshas are Vata, Pitta, Kapha. Dhatus are Rasa, Rakta, Mamsa, Medo, Asti, Majja, Shukra dhatus. And then 3 mala: Purisha, Mutra, and Sweda. Stools, urine, and sweat. So we need to Ayurveda studies in much detail about dosha, dhatu, and mala and their balance. And whenever there is a disturbance in these doshas or dhatus or malas, then you will find a specific disease. And to counter the disease, Ayurveda is having various types of treatments. And Ayurveda speaks about a specific treatment out of classification of 3 treatments. So first therapy is called Daiva Vyapashraya Chikitsa. So it is a belief that even if you are maintaining your body in a wonderful way, still you might get affected with some disease because of some, wrong karma committed in maybe the previous janma, previous incarnation. So Daiva Vyapashraya Chikitsa is effective where you don't find a specific reason for that particular disease. So there are so many ways which are not in the scope of Ayurveda, which come, go to a different branch like Mantra, Aushadhi, Manimangala, Palyupahara, Swasthena, all those practices which try to clear the karma and treat the patient. They are Daiva Vyapashraya Chikitsa. But the Yukti Vyapashraya Chikitsa is the one which Ayurveda addresses. Yukti Vyapashraya Chikitsa is the Chikitsa performed by the physician after understanding the proper diagnosis and taking many things into consideration. Using his Yukti, he will formulate a treatment procedure. And of course, there is Sattva Vajaya Chikitsa where you will try to overcome the disease by strengthening your mind and gaining control over your mind. So Indian tradition speaks volumes about gaining control of your mind, getting that victory over your mind, over your senses. So that is Sattva Vajaya Chikitsa. So if you want to classify the actual therapy called Yukti Vyapashraya Chikitsa, there are two types, Shodhana Chikitsa and Shamana Chikitsa. Whenever there is a disturbance in Vata, Pitta and Kapha, whenever there is a disturbance in all the doshas, all the tissues, all the organs due to the disturbance in these three doshas, we will be able to correct the disturbance with simple medicines if the disturbance is not very big. So the therapy which we do in such conditions is called Shamana Chikitsa. We do simple medicines and also we suggest some kind of food modifications, lifestyle modifications, which will help the medicines correct the imbalance and bring the harmony back into the body. And that treatment is called Shamana Chikitsa. Then we have Shodhana Chikitsa. Shodhana Chikitsa is the treatment which will try to eliminate all those aggravated free radicals in the form of doshas. So removing these toxins from each and every cell of the body and then thereby bringing balance back to the body is called Shodhana Chikitsa. So this is the broad classification, Shamana Chikitsa and Shodhana Chikitsa. And if you go deeper into the Shodhana Chikitsa, there are 5 kinds of Shodhana Chikitsas. We call them Panchakarma. Panchakarma, you can say these 5 detoxification and metabolism correction therapies will also help in regeneration, rejuvenation, revitalization, and healing so many disturbances inside the body. The first one is called Vamana Karma, where we try to accumulate all the toxins from each and every cell of the body, bring them out of those cells, bring them into one place, and then removing those toxins in the form of vomitings. That is called Vamana Karma. Then we have Virejan Karma, in which we also remove these toxins from each and every cell of the body through the anal route. So we prepare the body for a long time to send the medicine into each and every cell of the body, from where the medicine will be able to kick these toxins out of the cell, and then they will be collected in one particular place. And for this thing, proper preparation is needed. Now, after proper preparation, once the detoxification happens, then to bring back balance again, we observe very strict diet restrictions. So these Vamana and Virejana therapies are very, very effective in detoxifying the body and bringing balance back to the body. So this detoxification will stop so many disturbances and stop things like degeneration in every part of the body when it is happening. If you want to stop the degeneration, you have to start this detoxification. Then there are some regenerative therapies like Vasti, Nasya Karma, where the medicine enters each and every cell of the body and promotes regeneration. Whether it is a degenerated bone or cartilage in your knee or heel or hip or lower back or neck or shoulder or anywhere, or whether it is a damaged organ which is not performing properly, whether it is a liver or kidney or pancreas or any other organ. This regeneration happens with the help of these metabolism correction therapies, which will bring this normalcy back. And the best part is they will not try to substitute any of the bodily functions. They will try to motivate, stimulate those organs so that they will function at the optimal level without substituting any of the bodily functions with external medicines. Then there is a special therapy called Raktamokshana, where you remove this impure, clogged, stuck, obstructed blood from places where it is not possible to put a needle and extract the bad blood. There you use various measures like Sira Vedana, Jalukavacharana, Alabu, so many ways to remove these toxins through the bad blood. So these 5 therapies are called Panchakarma therapies, which are very, very effective. Of course, to help these Panchakarma therapies give better result, there are around 41 external therapies like massage, Abhyanga, steam bath, Bhashpa Sweda, Patra Potali Sweda, or it's a fermentation with fried leaves. And then Shirodhara, Takradhara, Dhanyamla Dhara, Kashaya Dhara, pouring medicated liquids either on the forehead or on the whole body. And then there are other therapies like Kativasti, Janavasti, Grivavasti, Urovasti, Merudandavasti, making some places where the medicated oils will stay. So many therapies which support the actual internal Panchakarma therapies so that the disturbances in the body, human body, will get corrected. So I am practicing Panchakarma from the past 20 years, and we have treated some really challenging conditions, and we have tried to perform some really you can say mind-blowing therapies. Some therapies in our hospital, we had the opportunity to try some really great therapies which we have not seen during our studies, during our training. We have given a non-stop therapy for 1 year, 10 months, almost 22 months for a kid of age 4 years with a problem called Hunter syndrome. Non-stop we gave bastis for 1 year, 10 months, which is a record. I have not seen any other patient with any other doctor who underwent such a long therapy. And luckily we were able to save the child. There are challenging diseases like Hunter syndrome and so many other things like avascular necrosis, Sjogren syndrome, systemic lupus erythematosus. So ankylosing spondylitis, vasculitis, so many conditions where the problems are much, much smaller than the negative effects of the treatments themselves in allopathic system. The medicines they give to handle those conditions, which may not treat the problem, but maybe giving some relief. But the side effects of those medicines and those treatments were much, much worse than the disease itself. In such conditions, Ayurveda works wonderfully with the help of this beautiful therapy called Panchakarma. So that is the greatest contribution from Ayurveda to this entire world. But I do feel that people praise Ayurveda for so many beautiful therapies. But as a firm believer of Ayurveda, I feel that the greatness of Ayurveda lies not in the treatments, but lies in the prevention of the diseases. So this entire topic called Swastha Vritta is a branch of Ayurveda which speaks about preserving the health of a healthy person. And it is classified into 3 types. One is Dinacharya. What do we have to do right from the morning? You wake up in the morning and you sleep in the night, and between the entire time, whole day, what are those practices which will help you stay healthy always for 100 years without any problem? That is Dinacharya. Then we have Rutucharya. Rutucharya or seasonal regimen, which speaks about the specific food we have to take in a specific season, specific lifestyle we have to follow in a specific season, specific work, and the quantity of exercise we can do in that specific season, and so many other things regarding the season, so that we will not be affected by the changes in seasons regularly. Particularly in the junction between one season to another season, majority of the people get affected and get diseases in the junction. It is called Ritu Sandhi. What do we have to do to stay healthy even in that critical junction? It was discussed in detail in Ayurveda. Then we have Sadvritam. Sadvritam is the moral aspect of human life, where we learn how to interact with others, with your family members, with your friends, with your relatives, with your teachers, with your boss, with your subordinate, so that you will always stay happy and healthy. How to maintain good relations, how to stay happy. This is something which we all have to learn, because World Health Organization says that health is not absence of disease or infirmity. Health is a state of physical, mental, and social well-being. Physically, you have to be fit. All the organs and organ systems should work in a wonderful way. Mentally, you have to be strong. You should have that control over your mind or over your senses. And after that, you have to be in a sound state socially. What is this social well-being? So, if you want to stay healthy, then your relationships with your family members, with your friends, with your relatives, with everyone with whom you interact on a day-to-day basis, those relationships should be sound. And Ayurveda speaks volumes about that Sadvrita, so that you can maintain a healthy human relationship. And also Ayurveda speaks about the fourth facet added recently by World Health Organization, that is spiritual well-being. So even if you are physically fit, mentally strong, and you are very good with your friends and relatives, your relationships are good, but if you don't have a purpose in life, you don't know why you are here, and you are not traveling towards that purpose, you don't have a goal, right goal, ultimate goal for which you came to this world and take this birth. So if you don't understand it, and if you don't travel in that direction, then you are not healthy according to World Health Organization. That spiritual well-being is also necessary. Ayurveda speaks all these things. Shushrutacharya says, Samadosha samagnischa samadhatu malakriyaha prasannatmendriya manaha swastha ityabadiyate. So the doshas, dhatus, malas, cells, tissues, organs, organ systems, if they all are working properly, and then prasanna atma indriya manaha, your sense organs, your mind, your soul, if all of them are there in a prasanna sthiti, in a beautiful state of bliss, then only you are healthy. That was the definition given by Sushruta, the father of surgery, 3000 years back. And now World Health Organization is adding one by one all these facets. So we have designed this holistic human health course with these health principles of Ayurveda Swastha Vritta in the background. We have designed this entire course for engineering students. And we are also doing the same, teaching the same at our hospital. Today we have completed the 9th Ayurveda Yoga Sikshana Saptaha, 7 days in workshop at our place. Got completed today, and just immediately after the completion, I came to this session. So I'm very happy to announce that very soon we will be doing the same thing in English also, most probably in the next month or in the month of January. We will let you know. in the next week itself. So I would like to introduce this holistic human health based on Ayurveda and yoga. If you look at this slide, the yellow part is the understanding part. So you will understand everything about human body and mind and the principles governing this human body and how this harmony in health can be maintained. And of course, what is the purpose of health and how do you know whether you are healthy or not? The indicators of health, everything will be, discussed in this understanding part. Then we will apply these principles in our day-to-day life so that we will be able to keep our body and mind in harmony without any disease. But even if you do that, if there is some disturbance, how to know about that disturbance in a very initial stage, how to know about these premonitory symptoms which appear long before the actual manifestation of the disease. And once you observe those changes, how you can prevent the manifestation of the disease in the form of dietary correction of lifestyle. All these things we will speak in this holistic human health. So if you look at the keeping body and mind in harmony, the nurturing part and protecting part, nurturing your body with the help of intake of food, water, air, and sunlight, routine, which includes the dinacharya, and of course, labor, exercise, asana, pranayam, meditation, all these things which nurture your body are included, and protecting the body with the right clothing, right footwear, right shelter, and designing your lifestyle in the right way so that you, your family, your society, and the entire nature can stay healthy in a state of coexistence. Understanding individual constitution so that we will understand what is good for our own constitution, what is the right way of living life with our own constitution, and understanding the concept of regeneration and revitalization. All these things will be discussed in holistic human health. And this got introduced in the educational curriculum because nowadays everyone wants to stay healthy. Everyone is resorting to social media to know about some information. But unfortunately, on social media, on Facebook or WhatsApp or YouTube or Twitter, everywhere the information is in bits and pieces in the form of health tips, do's and don'ts, rules and regulations. You eat this food or drink that chai, that tea, or drink that decoction, take this herb, take that leaf, or follow this diet routine, or follow that yoga routine, or something like that, and your problems will be solved. These shortcuts, these prescriptions, universal prescriptions for everyone with those problems are not at all helping. Sometimes they are causing adverse side effects. In that stage, this holistic human health comes like a boon because we don't give these rules and regulations and do's and don'ts. We have introduced this wonderful concept called universal health principles, which are common for everyone. Application of these principles may vary from person to person, place to place, time to time, but the principles are universal. They will not change from person to person or place to place or time to time. So these universal health principles, once you put them into practice and design your own lifestyle, no one else will prescribe a lifestyle for you. You have to design your own lifestyle. Once you do that, you can stay healthy. So that, dear friends, is holistic human health, and that is the contribution of India to the well-being of this entire world, not just the human beings, for the well-being of the entire planet. So in the coming weeks, we will again start exploring these principles and put them into application, and will also invite you to the upcoming workshop very soon. So we have completed our time. If you have any questions, we can ask. So someone is asking in the chat window, sir, explain the difference between communicable diseases and non-communicable diseases with examples. Communicable diseases are the diseases which transfer from one person to another person with the help of through the air or water or through blood, or the infections like corona. Any epidemic, pandemic, or any disease which spreads from one person to another person is a communicable disease. Non-communicable diseases are the lifestyle disorders which will not spread from one person to person if they touch each other or live together. They will not spread from one person to person. For example, hypertension, cancer, BP, some heart problems, obesity. They will not spread by touching. Jagdish Garu is asking what is the difference between Siddha and Ayurveda. So actually, Ayurveda is the science which encompasses almost most of the treatment procedures. But Siddha is a science which specifically deals with minerals as medicines. Gold, silver, mercury, lead, all those things. Dhatu Vada, alchemy, was used to make medicines out of this heavy metals. And many doctors who used these metals to treat diseases were from Tamil Nadu, and they wrote these scriptures in Tamil, and then that science became a special science, a branch of Ayurveda. Now it became a full-fledged science called Siddha. So, any other questions? Someone has raised their hands. Joseph G, I'm allowing you to talk. You can unmute and ask.
Namaste, Bhaiya.
Namaste.
Last week in our UHV common meeting, first week of the month, they showed the book that you wrote along with Professor Asthana Gaur. So they said it is available in the e-book. I want to know whether it is available in the printing also in the form of a book.
Printing is happening. Printing is happening. It has the physical book has not yet reached. So once it reaches us, we will surely let you know. It might take 1 more month to get physical copy.
Okay. Okay, thank you.
From our side, we have written it and given to them. It's in their hands to print and publish.
Okay.
Okay.
What's the name of that book?
Holistic Health.
Okay. Thank you, Bhaiya.
Welcome.
Ji, thank you, Sundaraj Bhaiya, and thank you all the co-students. It's really a mesmerizing experience, and certainly the self-awareness is how much important, which keeps us, and we reminds us that don't bother about what to do when we fall sick. Rather, what to do to remain healthy and fit is more important. Thank you, Sundar Bhaiya, to guiding us, and we certainly like to have more and more such discussion. We'll meet again next Friday, same time for the same discussion. And till then, keep exploring and happy Dhanteras and Deepavali once more to all my co-explorers. Thank you, everybody. Namaste, ji. Namaste.
Happy Dhanvantri Jayanti and World Ayurveda Day. Once
Certainly.
again.
Thank